welcome to SQ TV Global once again. I'm your host Rajni Bharara. Today on the show, I have with me again Dr. Syed Nusrath, who is a cancer surgeon. And today on the show, we are going to speak with him about hernia and every detail about hernia. But before, let's welcome him to SQ TV Global again and also to the show. Dr. Syed, welcome to SQ TV Global once again.
Thank you very much, Rajni. Nice talking to you again and again.
Thank you so much. Thank you so much. Thank you so much for taking out time and doing the show. Looking at you, I can tell that you must be really, really busy because you are still in your doctor's uniform. So again, I would like to thank you for coming and doing the show.
Just I finished a surgery, hernia surgery. And then I was rushing because you had given me the time at 7 o'clock. So I had to come and join you.
Thank you so much, doctor. Thank you. So, doctor, now, without wasting any time, let's just start the show. And I would like to, directly ask my very first question to you. So, like I mentioned in the beginning of the show, that today we are going to discuss with you about hernia. So, doctor, when I talk about hernia, so if you can please explain to the audiences what exactly is hernia.
Hernia is the protrusion of the content from the abdominal wall. It comes out of the abdominal wall, but the skin will be intact. So in the hernia, we have number one, inguinal hernia. Then we have got epigastric hernia. Then we have got umbilical hernia. Then we have incisional hernia. So these are the most common hernias which are seen in a male or in a female. And in females, we call it as a femoral hernia. So these are the various type of hernias you come across in patients. So the skin will be intact and then the abdominal wall gets protruded out. And then it comes like a bag and then it hangs from in front of the abdomen.
Okay. But
so
doctor,
that is hernia.
Yeah. But doctor, also, what is that thing that gets hernia in people?
Great. Now, what happens in the hernia is if there is a weakness in the abdominal wall, number one, most commonly, this is more common in the laborers where they lift the heavy weights. They lift the heavy weights and then there's a weakness which is caused in the abdominal wall. So once there is weakness which is called, these things protrude outside. So most commonly, whenever you see a laborer lifting heavy weights, his muscles become weak, number one. Second thing is, whenever you operate a patient and then there's a scar, and then post-operatively, you don't take care of that, and then again from that, the contents comes out. The sac becomes loose, protrudes out. So that is known as the incisional hernia. So there are different types of hernia. One is the epigastric hernia, umbilical hernia, and then incisional hernia, inguinal hernia. And in females, we of course have a femoral hernia. So it is always caused due to weakness, number one. Second thing is, if the patient has got a chronic cough, he keeps on coughing, then the intra-abdominal pressure becomes increased in size. So once it becomes increased in size, again the weakness starts, then again it keeps on protruding. Other third thing is when the person strains during micturition, that is when passing urine, the intra-abdominal pressure increases. Whenever there's an intra-abdominal pressure increases, the abdominal condition becomes looser and it comes up. The fourth thing is whenever the patient strains during constipation he strains. So whenever there's a strain in the abdominal wall, there's no other space to go. The abdominal wall comes forward, and this is the most important cause of hernia. So these are the various reasons why the patient should get a hernia. So once you control this you should control your cough. If your micturition is all right, if your motion is all right, you don't lift heavy weights, and then 33% to 40% common for the surgical patients, where they get operated and post-operatively from the incision side, you get a hernia.
Okay. Doctor, so, also, what are the signs and symptoms, if a person have got hernia, so what are the signs and symptoms that would tell that, okay, so the person have got hernia?
Yes, good question. Now, whenever a patient has got hernia, he comes to the hospital with saying that I have a swelling.
Okay.
The swelling may be in the lower abdomen, that is the inguinal region. There may be in the above the umbilicus. There may be in the umbilicus, or it may be below the umbilicus. So these are the most common site. Patient gives a ball-like swelling over the abdomen, which becomes more prominent when he coughs
Okay.
or when he lifts a heavy weight. You lift a heavy weight, suddenly something ball-like thing comes in front of your stomach, your skin, your abdomen. That is the most important. That will push the patient to consult a doctor or a consultant or a specialist. Because this will be the moment he sees first time, it will be a small one. So he'll be thinking probably it will go off. So that keeps on becoming bigger and bigger in size. And then finally, whatever the abdominal content is there, that starts coming out. And that is the dangerous signs and symptoms. Before that comes, one has to consult the doctor so that you get the correct treatment.
Okay. Okay. So, doctor, also, is there a differentiation in hernia in male and female?
Well, yes. In female, most commonly, we see very rare, which is known as the femoral hernia.
Okay.
But in male, we have the inguinal hernia. That is the most common difference.
Okay.
Then, in case of incisional hernia, following some operation, especially after giving birth, cesarean sections, most commonly, the incision is made. We make an incision like this, which is known as the phalangeal incision, which is the transverse incision. So we have seen a lot of cases coming with that incision where normally the ladies start working. This is the biggest problem. So you from the media should convince the patient so that they get a message that following cesarean section, you should be very careful. You should not lift heavy weight or they carry the babies. That is the most common straining factor.
Okay.
Whenever you lift the heavy weight, it causes straining, and this is the most common cause for hernia. In female, we have most commonly incisional hernia and femoral hernia, but in male, we have inguinal hernia, umbilical, or epigastric hernias.
Okay. Okay. So, doctor, also my other question to you is, does hernia, or the patients who have constipation issues, can they get hernia?
Yes. What happens is constipation, the patient tries to strain a lot.
Okay.
He should not strain. He sits, and then when he's passing motion, especially in habitual constipated cases, the intra-abdominal pressure is raised. They try to strain. So once they try to strain, the motion comes slowly, and then our intra-abdominal pressure becomes increased, and that will be one of the causative factor for a hernia. So constipation is the most important cause of a hernia.
Okay. Okay. So also, doctor, is there any age specific thing that only this age can get, or age above these people can get?
Very good question. Now, we call it the congenital hernia, where the weakness is for the children also. In some children also, the moment the child is born, we get a swelling. So there is no age bar. We can see after the childbirth, number one. And then in that one, you can make it very clearly. You can have a phimosis where the child is not able to pass urine. So whenever he's not able to pass urine, abdominal pressure gets increased. And then the strain is over the inguinal region. So that is one variety which is known as the congenital hernia. The other one is again in the children where they do active exercises, running and rough exercise or lifting heavy weights. Again, they'll develop inguinal. But in elderly, due to this constipation or due to micturition and due to heavy lifting of the weight, you have this umbilical hernia.
Yeah, I was saying, is surgical mesh for hernia safe?
Yes. Now, the treatment, the first and foremost is once you consult the doctor, the inspection, the patient examine the patient, and then he decides whether this requires surgery. Invariably, hernia requires surgery. So what happens is, in this case, in hernia, the first and foremost treatment is nothing but surgery. You have to operate the patient, and then surgery is the most important. In surgery, what we do is we have to try for a mesh. It's known as the mesh herniaplasty. You put a mesh, which is a foreign body, and then you just apply that and put some sutures. And definitely it is safe.
Okay. Doctor, also, what are the potential complications for hernia, of hernia?
Yeah, good. Now, what happens is once you get a hernia, you should not delay it all the time.
Okay.
What happens is the 2 centimeters become 4 centimeters, 4 centimeters become 6 centimeters, and it keeps on becoming increase in size. Now, once that happens, next thing what happens to you is whatever the contents from the abdomen start coming out. In the abdomen, we have omentum, then we have the small bowel, then we have the large bowel. So one by one, they keeps on coming outside. So now the patient, once these things started coming out, the pain goes out, the patient will have vomiting. And these are the dangerous symptoms and signs. So whenever you have these things, what you are supposed to do is you have to consult a doctor, and then these are the complication which develops. And then sometimes what happens is we have the neck, the body. So the necks get constricted. So once the omentum comes, or the small intestine, or the large intestine comes, closes like a valve. So once it closes, what happens is then the complication starts. You're not able to eat, you're not able to sit, and you keep on have vomiting. So these will be the dangerous symptoms whenever the patient comes in the case of hernia.
Okay. So also, in females, when they get hernia, so does that also cause infertility issues in them?
Infertility.
Yeah.
Well, what happens is in this hernia, normally infertility does not take place, but the hernia is causing the bowel and the bladder sometimes to come out. So infertility, it happens only if the tube comes and gets stuck in the sac. That is the most important fact. Or ovary comes and gets stuck, which is very, very rare, probably 1% or 2%. But per se hernia, because it is in the anterior abdominal wall, infertility chances are very, very less, decimal point, because unless and until the ovary comes, because God has given such a nice structures, before these things comes, the omentum comes and stop these things. So first the omentum comes, or the small ball comes, or if it's a huge sac, then only sometimes the ovary and the tube comes, and once this comes, then definitely there are chances.
Okay. Also, doctor, when can hernia become an emergency? If you can please also talk about that.
Yeah, that's a nice question. What happens is now the hernia, the patient keeps on growing it, probably 1 week, 1 month,
By
2 months,
ignoring it.
6 months. Ignoring, that's correct. That's the correct word which I didn't want to use. Ignorant of that hernia, or he says, or sometimes there are some financial condition as well. So these are the predisposing factor number one. And a smoker, chronic smoker, or a passive smoker, a lady. Ladies are also smoking nowadays. So these are the risk factors. So once the hernia comes and then it gets obstructed or incarcerated, where the blood supply is compromised, what happens is the blood supply gets compromised and it gets stuck. And once it gets stuck, the patient will have complications. And these complications will be present in the form of vomiting. And what happens is, if the intestine comes and gets stuck over there, then you have it. The biggest problem, what happens here is the bowel gets obstructed, the patient becomes gangrene, which becomes black coloration because the vascularity is compromised there. So once the vascularity gets compromised, the patient will land up into more complication. And in this case, whenever you operate it, you have to see whether the intestine is viable or it is not viable.
Okay. Also, doctor, so what is the typical hernia surgery recovery time?
Well, it depends on the hernia. Nowadays, what happens is there is a lot of techniques which have come in a hernia. Now we have first is we used to open the hernia and then we used to operate it, push the content inside and put a mesh over that and then suture it. But now it has come as a laparoscopic surgery. So you admit the patient in the morning and discharge the patient in the evening or the next day. But this takes a lot of expertise because this is under trial now. Laparoscopic people are doing, but it's always better to do open surgery where the results are good. You see that. And still patients are doing the direct inguinal hernia, laparoscopic surgery, which is again, in case of an umbilical hernia, again, we are doing an open surgery where you can have a picture. I can show you some pictures in that where they put a mesh, open the technique, put a mesh, then close it. And then same thing is being doing under laparoscopic, where the patient will be discharged the same day or the next day.
Okay. Okay. So, doctor, you actually explained the different types of hernia also. So, in all these types of hernia, which is the most dangerous form or dangerous type of hernia?
Good. The most dangerous type of hernia is incisional hernia because you operate the patient and then you operate the patient and then you operate the patient. So once, especially ladies, once the patients get operated, you have to be very careful that you use an abdominal binder. You don't lift the heavy weight. Chronic cough is controlled. So that is it. Because once you operate, second time you operate, the abdominal wall becomes thin and thin and thin, thin out, thin out, thin out. That is the biggest problem in hernia. So once the intestine comes out, then the problems start.
Okay.
Then the most important cause will be obesity. The ladies are very, very fat. So through that, it keeps on protruding out, and that will be the cause. And become, I have seen some where there are thin papery skin. So just below the skin, you put a mesh on top of that and fix that.
Okay. Okay. Got it. So, doctor, also, which hernia is the most and least likely to strangulate?
Well, that happens in inguinal hernia as well.
Okay.
Inguinal hernia as well. We say indirect inguinal hernia. What happens is the small bowel comes sometimes. or sometimes the bladder comes into that content. That is the
Mhm.
urinary bladder, you say. Then we have sometimes the appendix which comes, or sometimes two part of the hernia comes, W-shaped hernia we call it. So when this comes, they come and they get strangulated over there. So once they get strangulated, the the vascularity is compromised. Number one, then the patient will repeatedly have vomiting, will not be able to sit, and there will be severe pain.
Mhm.
So that will be an emergency procedure which we are supposed to take. Same thing applies with the incisional hernia. It comes and it gets stuck, and the momentum. Luckily, what we have is the momentum will come first and then close it. Then with that, the small intestine and the large intestine comes. Then this is again becomes complicated and it becomes strangulated.
Okay, okay. And which is the most which is the least likely to strangulate?
Inguinal hernia. Inguinal hernia normally strangulates. The bowel comes over there and the vascularity is compromised and it gets strangulated. Whereas the direct inguinal hernia, it never goes into complications.
Okay. But doctor, also, a major question is, can hernia also cause death?
Oh, yeah.
Okay.
Well, what happens, the death is due to the other comorbid because what happens is sometimes the elderly patients, specifically cardiac compromised patients, are associated with some renal diseases or diabetes, uncontrolled diabetes, and then obstructed hernia or strangulated hernia, where they have some bowel pathology as well, associated with kidney diseases as well. Kidney disease is also very, very common. So these are the comorbid conditions and chronic cough. And especially now we have this our great COVID.
Yeah.
So with this COVID, the patient keeps on coughing, and the intra-abdominal pressure increases. This is the most important cause.
Okay, okay. And also, are surgeries necessary for hernia? I mean, to treat hernia, are surgeries necessary, or can they also pass?
Earlier, the better surgery. Surgery is a must. Today,
Oh,
tomorrow, day after tomorrow, 1 month, 6 months, yes, you have to get operated. There is no question of no surgery because it keeps on becoming increasing in size. There is no question of there is a treatment of medicine. So many people come and ask, is there any medicine for that? No. And some people in the inguinal hernia use a belt called truss. That also causes strangulation. It also causes inflame. It also causes constipation. So that is the most important cause of the hernia. So you have to get it treated because irreducibility is there. It does not get reduced. That is the most important cause. Sometimes what happens is hernia comes, then you try to reduce it, it goes back. Again, you stand up, you walk, again it comes. Again, you lie down, it goes back. So once this stops coming, then you are supposed to go in for a surgery. That is a must.
okay, okay. Lastly, doctor, are there any myths attached to hernia that you would like to educate the audiences about?
Yeah, people think that is due to some black magic or some white magic and somebody it's a curse and all that. So I don't think there is any myth attached to it. Or they say that this has happened. No, you go climb because he has climbed this tree, this fellow has developed a myth and then a hernia. No, this is just plainly due to raised intra-abdominal pressure where there's a weakness in the
Okay.
muscle.
So
And
people
then
attach.
that is the most common cause.
Okay, so people attach superstition to hernia.
But it's not at all there.
Nothing.
Hernia is a disease which is an anatomical, which is a bread and butter for the surgeons.
Okay.
So every operation, alternate case. Today I did one. So it's just a myth which is attached to that.
Okay, okay. Thank you so much, Dr. Syed, for coming to SQ TV and again speaking with us and educating our audiences on such an important topic. Thank you so much for all your details and information on hernia. It was again a pleasure having you on the show.
Really pleasure talking to you. You asked a lot of good questions. Thank you very much. Take care, stay safe, prevent hernia.
Thank you so much. Thank you. All right, guys, that's it from SQ TV Global. Keep on watching and subscribe to the channel.